Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors, by the doctors. And we here on The Social Doctor are on a mission to help doctors with their career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Rahul Chandhok with us. With more than 18 years of his experience, he's here to tell us about the career planning after MD Psychiatry. How did he plan his career and to guide the upcoming graduates in doing so? Welcome, Doctor, on the platform. It's really nice to have you here.
Namaskar. So I'm Dr. Rahul Chandhok. I'm a senior consultant psychiatrist practicing in Delhi NCR, mainly Delhi and Faridabad. I'm associated with the Fortis group of hospitals, as well as I have my own practice at the clinic. Yes. So thank you, Ayushi, for giving me this opportunity to interact with fellow doctors, and hope I would be able to guide them.
Definitely. I'm pretty sure your guidance will definitely help them. So let's start with your journey. How has it been with so many years? How did you evolve, getting settled here in Delhi NCR?
So I belong to Delhi.
Okay.
So I did my MBBS from Orissa through the All India selection. So when I went out, there was always an urge to come back to Delhi and settle here, Delhi or the nearby areas. So while selecting my PG, this was one of the main things that I wanted an end branch as well as something which would help me settle down in Delhi NCR. It should be an upcoming branch. There should not be too much of saturation, because most of the branches in medicine, if you select a big metro, they already have a lot of practitioners. So when I picked it up, there was this thing going around that in 2020, depression would become a big thing. Okay. So I selected psychiatry, and during my MD, I had exposure and opportunity to visit NIMHANS, PGI for further trainings. After finishing my MD, I joined senior residency at Safdargunj Hospital, which gave me a base in Delhi and honed and enhanced my skills. Whatever I had learned in the academic way, I was able to put to practical, form my own strategies, how to manage patients, how to manage them, especially in the OPD settings. During those days, Safdargunj didn't have an indoor ward as it does now. So it was always a challenge to manage difficult cases in the OPD setting. So Safdargunj residency helped me a lot in developing those skills, and which have paid me very well during my practice years.
Correct.
After finishing senior residency from Safdargunj, I joined the corporate world. At the same time, started practicing in the clinics also. I did chamber practice for a long period of time till 2012. And thereafter, I got committed to Fortis exclusively. A few years, I remained like that. And then I opened my own clinic in 2016. So it has been like a fantastic journey. God has been kind that I got the opportunity to serve my patients well in various capacities.
Definitely.
This has been there.
I'm sure, after hearing also, I think it would have been a really nice journey till now. So now, what are the kind of career opportunities? Let's discuss about the topic. What are the kind of career opportunities that you think are there after MD and DPM for students?
So when we talk about the career opportunities in psychiatry, for DPM, the candidate doctor should be very clear whether the person wants to pursue a DNB or not. And secondly, whether the person wants to pursue a teaching career or not. So if a person is a DPM and is not interested for a DNB or a teaching career, yes, the person should just plan to launch a practice. And because essential basic trainings besides the research part is definitely imparted in the DPM also. But if you think that you should hone your skills a little more in practice, you should have more patient experience, because in most of the training part, we are taught. But to independently handle cases, to manage them over a period of time, and to see how various psychiatric disorders respond. And because in psychiatry, it's basically a combination of medicines. It is always polypharmacy, which, and the books are always from a single medicine point of view. So there is no escaping polypharmacy, which you have to do on your own. And mostly the opportunity comes once you finish your MD or DPM. Okay. So first thing to decide, I think, is whether you are going in for a teaching career or you're going in for a practice right after your post-graduation.
Okay. Okay.
So if you're going for a teaching career, definitely I would suggest that you would have to do a senior residency. Sure. And then only you would become eligible to become an assistant professor.
Okay.
So for senior residency, there are various government institutions, there are medical colleges which offer the post, and you should select the one where there is good patient load, there are good facilities, so you have enough opportunities to learn and practice. With newer techniques like RTMS coming up, if the institution has it, you will definitely get exposed, and it will enhance your confidence in the subsequent part of your career. So it becomes important if you select your institution like that. But still, it is also true that the number of seats in psychiatry has gone up dramatically. The government has increased them. So has the number of seats for senior residency, but they still fall much behind the number of postgraduates passing out. So not everybody is going to get a senior residency seat. The advantage with senior residency seat is that it ensures that you get a basic salary after your post-graduation.
Yes.
You're not on the road, because psychiatry being an end branch, and with most of the places not having a ward with them, it is a branch where to get a salary after you pass out from an institute is very difficult.
Okay. Okay.
Most of the setups are OPD based. So they would pick you up for a consultancy, but not offer you a regular salary or a minimum committed amount. So that becomes difficult, because most of the people, by the time they graduate from their MD or DPM, they're either into family or they're just married. So finance is definitely a concern at that point of time, in that stage of life.
So you mentioned about the teaching part. With senior residency, both MD as well as the DNB candidates can apply?
See, both can apply. Okay, a preference is always given to the MD candidates. Okay, but if no candidate is available, then DPM also. And but at the same time, DPM people, if they are looking for a senior residency thing, they can always join a DNB course, which would give them an additional degree also, as well as adequate exposure also.
Okay. Okay. And apart from the teaching part, what are the other career opportunities? You know, when it comes to government jobs, what are the kind of opportunities there after MD psychiatry?
So the government is ramping up availability of psychiatrists all across the nation. Both the central government and the state government is ramping up the availability of psychiatry OPDs in various government hospitals and institutions. So definitely the number of posts have gone up. But see, there is a selection criteria for that. Okay.
Correct.
And it depends what are your aspirations. And in lot many government positions, they come with a NPA clause that you are not allowed to practice away from the government institution. So it should be very clear to you what you want to do, whether you want to pursue a regular salary post in a government institution, because the salaries are pretty good now, and or you want to set up an independent practice, which will take time to build up, but could be financially more rewarding.
Okay. So now we have already discussed.
So it's like a high risk, high stake.
Okay. So, as already mentioned with the government thing. So if somebody does not want to go for the teaching and wants to set up their own private practice, let's discuss a bit on the private practice front. How did you select, obviously you have been brought up in Delhi, so this is your base. So you had set up here. But how will you suggest a person to select between a metro and a semi-urban place? Which is a better choice, and how should the person go for?
So let me explain about settling part. So you see, most of the people decide about where to settle depending upon whether they have been to that area for either they're a resident of it since their childhood or for most part of their education. So that's how they decide. Second thing to be noted is whether you have a number of practitioners practicing there, or you are going to be selecting an area where you will be providing it from the scratch.
Correct.
Both have their own advantages and disadvantages. Okay. If you are planning to start in an area where you have been residing, people know you. Okay. And sometimes it's a big help to establish a clinic, or because you can help others that way, and you can get help also. Okay. Many times some of your family members might be there in the profession. They can again help you and guide you. But if you are from outside our city and you want to join a new city to practice, I think the best way out is to join a hospital which provides chambers to practice in metros as well as semi-urban areas. Now, this is a common practice to provide chambers on a share basis. And they can start off their practice because that institution is already having a footfall. You only pay them a part of your earnings. So there is no initial burden. And so you can start off from there. You get to be associated with a good name or a brand. And that's how you can start. As you gain more confidence, your resources become better, then you can think of opening your own clinic. But at the same time, if you are in a semi-urban area and you know the location, the population pretty well, what is the cultural milieu of that that particular area? Because in psychiatry, the culture is very, very important. You have to understand the social and cultural milieu of the particular population.
Yes.
If you're comfortable, you can right away also start with your own clinic. And if you have the resources, you can open up a hospital.
Yes. That's true. But, the idea I wanted to ask is that there is a misconception that semi-urban places do not have that kind of flow, or, the patients are not aware, the general awareness. Is that the case, or it's just a myth? What is your opinion on that?
So you have to understand psychiatry practice also has its own sub-branches. It all also depends what kind of practice you want to build. So if you are keen on a child psychiatry practice, I would definitely suggest you pick up any metro for it, because child psychiatry practice also involves a lot of support people like psychologists and speech therapists, okay, special educators. It will be difficult to have these kind of resources in a semi-urban or at a distant place. Okay. So if you're keen on that, definitely a metro would be preferable, because people can travel, but you will be having the resources for which they will be traveling. So that is one. But suppose you are planning to open up a de-addiction, your interest area lies in de-addiction, then definitely it would be better to open a indoor space right from the scratch. You should plan for it, because it is a requirement that you, if you would admit people and detox them, then it is much more satisfying. The results are better. and it helps you in establishing yourself, right? But if you are mainly into adult psychiatry practice, okay, then the thing comes is that yes, you can open up a clinic as well as you can do a chamber practice. Okay, both are okay. Yes, if a combination of both works the best, and then again, depending upon your resources, you can decide. As regarding the myths regarding people coming to the psychiatrist is concerned, you see, we deal with disorders where the person have to take a treatment.
Yes.
Okay, and gradually they will keep on joining you. Okay. So because the spread of healthcare is now much wider, so whenever they will go to a particular doctor, they will be guided to a psychiatrist. So psychiatrist has to be available. Okay. As far as the taboo is concerned, it is there in the metros as well as in the semi-urban as well as in the rural areas. There is no difference.
Okay.
Okay. People do drop out even if you have educated them very well in the metros also. So there is no escaping from that. But if you educate them well, if you let them know that this is what is going to be required, then they listen. Okay. In my experience, it is like how you educate them. If you educate them well, if you spend little time with them, definitely it is going to pay off that they are going to follow. But a psychiatrist primarily deal with cases of psychiatric disorders. And there you need a psychiatrist to do anything. And once you demonstrate what kind of difference you can bring to people's life, they're going to stick. Okay. So you have to trust in your own skills. You have to not give up so easily because most of the disorders respond after a while. So you have to develop those skills, how to explain and how to retain a clientage till the result is there.
Okay. Okay. So now when coming up to setting up the practice, when a person plans to set up a clinic, what are the important points that a person should keep in mind?
Hello.
Yes, Dr. Rahul, so I asked you.
Hello.
Yes, can you hear me?
No.
Yeah. No. So now if a person...
Yeah, I can hear you now. Kindly repeat.
Yes. While setting up your practice, what are the important points a person should take care while setting up their own clinic? What is it that you think are important points, and who are your support staff that you should have?
So when we plan to set up a clinic, it is so now we have to understand that people would be, your patients would be coming in with their family members or their relatives or friends, majority of them, because when they are in an acute state, they are not able to come on their own. Okay. So whenever you plan to have a clinic, you must give adequate thought to if you are able to have a clinic at the ground floor, whether your clinic has enough parking area for the vehicles, because the patients would be coming in them. Okay, you should have a good waiting space. The challenge comes as your practice grows and the number of patient increases as you're sitting at a one place becomes longer. And all these factors come to play. Especially with Corona, nowadays, it is always better if you're doing a practice that you should be maintaining a social distancing thing. Can be only done if you have enough space for that.
Yes, yes, correct. And when it comes to support staff, what are the...
So I was explaining about the support staff.
Definitely, yes.
You see, you have to have reception people with you, and they should be people who should be able to handle agitated people in a calm manner. Okay, they should be able to deal with them. Then a lot of people, when they open up a clinic practice, they have a pharmacy with them. Okay, that becomes important because it supplements your income. A lot of people have a lab collection facility at their clinics, okay, which again supplements. So you need to have a staff for all this.
Correct, correct.
It becomes like a mini establishment minus the admission.
Yes. So that's actually good thing to know. The other day when we were discussing, you also added to have a psychologist. So what is the importance of having and what is your point?
So in psychiatry practice, a lot of counseling helps. We have various therapies for depression, anxiety, and suppose the psychiatrist is not able to take up the therapy themselves because they have a rush of the patients, then a psychologist is a big help because unless until the patient understands and cooperates, the chances of recovery also remain low.
Correct.
Okay.
Correct.
So to guide them, to educate them, to counsel them, if you are comfortable with having a psychotherapist with you, it is of big help.
Yes.
In most of the metros now, psychologists are available since the seats of clinical psychology courses have gone up dramatically. So people do seek attachments, but it should be very clear whether you're comfortable having another therapist sitting in your chamber or working along with you.
True. So that's actually a very, very important point that helps in your practice. So
yes. They can basically also do testing. See, in psychiatry, it is basically a clinical branch. We don't have much testing with us. So psychologists are the people who can provide a testing, which basically to educate patients why and what is happening with them comes in handy. Because if you have a printed report with you about what has happened to them, they are likely to listen to you more and follow up for a longer period.
True. So now with recent times, with Corona times, things have changed a bit with psychiatrists as well. Telemedicine has come into play in a big role. So how do you think telemedicine is helping in practices, as well as what are the pros and cons of the same?
So yes, telemedicine has come as a big boon. Earlier, the psychiatrist or various doctors, practitioners, they would give their opinion, but it would not have any legal sanctity. They were not able to practice freely. So with this Corona onset, the government has given permission to practice teleconsultation or telemedicine, which has come as a big boon. In psychiatry, it is basically an interview based on which we diagnose and treat. So the requirement for a physical examination is not absolute. It is basically judgment based whether you need it or not. So it has become easy to provide opinions or second opinions to people suffering from various psychiatric disorders in far-flung areas. When psychiatrists were not able to go to their clinics or to their chambers to practice, it was teleconsultation only which sustained both the patients and the doctors. So it is a very big positive. Okay. But at the same time, we also have to understand that in psychiatry, we need a lot of observations to come to a conclusion. So, and in most of the video consults, we are only able to see their faces only, not the whole body, or it is difficult to observe them moving. So again, given the circumstance, it is also not possible to observe them for a longer period of time. So that is a very contrary thing. Other thing is a lot of people, once they take opinions, it becomes they don't turn up for follow-up, and it is not possible. So they go unmonitored. In psychiatry practice, basically, it is like the discipline has to be as secure as for a cancer treatment, as you will not tinker with the medication or take charge of it on your own in the cancer therapies. Same is there in the psychiatry because we are writing medicines for the brain.
Yes, yes, yes. True. That's very important. So now, what are the things that you think as a practitioner you need to take care while taking telemedicine calls?
So first and foremost, like it is happening presently, also you should be very sure about the bandwidth, so that the calls don't get dropped. Okay, you should be organized. You should be very clear how to communicate. Okay, and wrap up the consult in the pre-decided period of time. Okay, so the more organized you are, the better it is. The more communicative you are, the way you are able to put across your viewpoint, what to say, how to say becomes very important, because the person is not sitting across a table. And a lot of people are still not comfortable using this medium, especially the older generation is just not comfortable. Yes. Even though some of my patients, old patients, have learned to use digital modes of payment for the first time to consult, but still they are not very comfortable because they are used to seeing their doctors in person to discuss so many things, which is usually feasible when they are in clinic. But at the same time, if you take up telemedicine in a disciplined way, you're very clear about the fee structure. You're very clear how to get the fee paid. You have, if you collect the fee in an advanced manner, if you have a system where they can be informed about a follow-up, yes, it is a very big benefit both to the doctors as well as the patients.
True, true. True. So now, when we have discussed a brief about the whole setting up the private practice, there are some questions from, some of the viewers.
Yes.
Dr. Abhishek is asking, is psychiatry a low earning branch and are jobs very less in India? What is your opinion?
So, as I said in the start of the interview also, that if you are looking for a job, okay, a job comes with a salary. Okay, the institution has to have enough work for you to pay you a salary. Okay, so most of the salary posts are there wherever there is a ward. Indoor admission is there. Okay, so if you are looking, and such indoor places are very few, still very few. Most of the big institutions are not having wards. So they don't take up psychiatrists as even senior residents or junior doctors or associates.
Okay. Okay.
Okay. But as far as the low earning branch is concerned, it all depends what kind of practice you are in. I know people who earn very well, and I think they earn as well as any other practice, leave aside the surgical super specialist.
Okay.
Okay. But so you have to set it up. You have to set up a practice, and then you have to decide how much you are going to put in, as for the resources as well as your own efforts. If you are available, are you going to work 7 days a week? Are you going to work 8 to 12 hours a day? Or you are not keen on that? So it all boils down to that.
Correct. Correct.
People have opened up their own de-addiction centers, and they have had roaring practice, and along with it a luxurious lifestyle in certain places of India, which can be envy of any practitioner.
Correct.
Okay. But it all depends what sort of practice you are keen on.
Yes, yes, yes. And actually, the other day when I was speaking to Dr. Rahul, he also mentioned that with psychiatry as a branch, there is a lot of consultations, follow-up consultations. So that also adds to your patient flow, and which actually adds to your income also. The more patients you see in the first 2 years also are there in your 5th year. So that is something which adds to the earnings. So this is very, for example, in surgical branch, that is not the case.
So in surgical branches, basically your old follow-ups, all the patients which you have treated would bring in new cases.
Yes.
So that turnover has to be kept very high. The flow of the new cases have to be kept very high. Okay. But in psychiatry, as the time passes, if you are able to retain your old patients, yes, they are going to stick with you because you have made them stable, you have helped them. So not only they bring new cases along with them, they themselves remain in the follow-up, which adds up to the income.
Yes. So there is actually 2 more questions from Dr. Manasvi.
Yes.
She's asking that job prospects of doing diploma in psychiatry, DNB. Something that we have already mentioned.
So DNB is different and diploma is different. DNB is diplomat, which is equivalent to MD.
Yes, she has written diploma in psychiatry bracket mein, not MD/DNB. Yes, you're right. I was wrong. Yes.
So you see, if you're clear in your head that you want to practice, doing a diploma saves you an year.
Okay.
But you should be doing it from an institution which has high caseload, which has a good faculty, so that in 2 years of training, you have enough practical clinical experience to diagnose and manage. This becomes very important because you are allowed to practice. So that is the charm of doing a diploma, because in practice, you are equivalent. You're not below the MD people or the DNB people, right? But you should have picked up enough skills. Then only it becomes worthwhile. So you should be doing it from a place where there is adequate exposure ensured.
Okay.
Then it becomes worthwhile.
Okay. And she's asking a second question that, she got a review from one of the psychiatrists saying that, the branch is of less income and no scope, and there are many psychiatrists who fall prey of depression also in the field. So what is your opinion on the same?
So let us divide this question. As far as psychiatrists falling prey to depression, it can happen to any of the specialists. You see, patients' misery, the doctors have to deal with in each and every case. Okay, so if we talk about cancer specialists, yes, they also see the misery and they also lose patients frequently. So getting into depression is not that only psychiatrists fall into that bracket. Yes, we do deal with cases who have a very high disability rate. Okay, so but it is part of your training how to remain dissociated from your work.
Correct.
How to switch on or switch off. If you are not able to do that, then it can affect you in any branch.
Correct.
Okay, that is one. As far as low income is concerned, see, it is very subjective. Okay, in teaching profession, if we talk about the salary of a professor presently is more than 2 lakhs in central government institutions or the medical colleges. More than 2 lakhs. So if you are working as a psychiatrist in such institutions, the income is not, at least the basic income is definitely ensured. And the opportunities and the competitions, since we are still less in numbers as compared to other branches, is definitely less.
True.
Okay. Second, you have to understand the patient response rate is definitely increasing. Okay, we have much better medicines now. So as we keep on giving better results, people keep on coming for those kind of results. Everybody wants to be better.
True.
So the psychiatry practice is definitely rising.
Yes.
We were overwhelmed with cases during the times when there was a lockdown, and because the stress had gone up. All the international organizations have predicted that stress in the living is going up, cases of depression are going up. So definitely the need of psychiatrists is also going up. Another thing is a career or a practice has no relation to from where you have graduated or post-graduated. Okay, a career or a practice has to be built up. It involves a lot of strategy. It involves a lot of choices. Okay, it is a work in progress. You have to keep on working on various aspects, just like you would work on a business. You have to engage with the other specialists in your area. You have to do some marketing. Okay, you have to hold camps. You have to engage with people in various ways. You have to learn how to use social media and all. And you also have to learn to manage your money, which is coming in.
Yes, definitely.
Okay, so that I know people who are psychiatrists, but they own luxury cars like BMWs and Jags. So naturally, they have earned it from their own practice. So it cannot be said it's a low income branch.
Yes. True.
Okay, but yes, they have really made a mark because of their own strategies, and they have been able to rise.
Yes.
Okay.
Yes.
I know of psychiatrists who would charge about a lakh per visit for home visits. So.
Correct. No, that's true. And I'm glad to know to all of this. This actually helps students to clear off their doubts. So now, if somebody wants to settle down outside, let's discuss this part also. If somebody after psychiatry wants to settle down outside India, how is the picture in that case?
So you have to understand, anybody trying to settle outside India, our medical practice is not, our license is not valid in any other country.
Correct.
Let us be very clear about that. It is like you have to do if you are keen on a psychiatry also only, then you have to give your MLEs and you have to again do the residency. Okay. But at the same time, from time to time, places like UK, Australia, they keep on coming with opportunities where they recognize our degrees, sometimes with exams, sometimes without exams, and they allow you to practice as psychiatrists in their own country by taking you on their own registers.
Okay.
So such opportunities keep on coming. Okay. So it all depends from where you have done your MD and how much experience do you have, and you have to spot those opportunities. Such opportunities do come.
Achha. Okay. That's nice to know actually. So now if somebody wants to pursue psychiatry, what is your suggestion to the to the fresh graduates who are on their journey for the graduation?
So now we are seeing a lot of female psychiatrists coming up as the seats have gone up. This is earlier there used to be very few female psychiatrists, but it has definitely, the scenario is changed now. More and more females are taking it up since very few institutions don't have a ward, so it becomes like a day work with no evening shifts or night shifts. So it becomes easier to manage.
Yes.
Okay. So every thing has their own pros and cons.
Correct.
Okay. For people who are looking at it from a easy going thing, okay, a relaxed practice, yes, it could be a very worthwhile thing because in other branches you have to be available 24/7.
Correct. True.
Here you can manage your practice the way you like.
Yes.
Okay. So that is the charm of it, and that is why a lot of people are coming and taking up this branch.
Yes. And especially, I believe, with the current pandemic, everybody has seen that depression is playing such a major part. So I'm sure this is something that is also one reason that government is also getting easy with the seats and everything.
So government is not getting as easy with only psychiatry seats. Government has basically changed the criteria a little, and now the number of seats in the institutions have gone up.
Correct.
The plan is to have more specialists so that the services become accessible even at the remote places.
Okay. And anything else that you want to suggest people before picking up psychiatry, something that they need to have in their mind that you have faced, that you think is important to be,
the most crucial is why you have taken psychiatry. What has because that is something which will keep on guiding you during the days when you practice, your struggle days, even later when you are settled. So I picked up psychiatry, and when I joined, it was more of an end branch, which would help me in settling in a metro.
Yes.
With very few people taking it up at that point of time. But what made me stick to psychiatry was that you treat one person in psychiatry and you help the entire family, because they are in deep distress. In India, the family bonds are very strong. Even if one person falls sick and remains sick, it plays a havoc with the entire family, and with no social support from the government, they face a disaster. So, and if you treat a psychiatric patient, if you make the person stable, so it is very emotionally rewarding, because the entire family is grateful to you, and so that gives you a lot of satisfaction. So that is something. So suppose a person is suicidal and you are able to rehabilitate the person into a job again. Not only the person, but the entire family, which was going in distress. Or there are long-standing disorders like schizophrenia or bipolar. If you are able to stabilize them and keep them stable so that they are able to work, naturally, they are having families then.
Correct.
So this is a very satisfying thing. And this is what makes a psychiatrist going on in their struggle, in the middle of all the misery that they see day in, day out.
Yes. True. I completely agree. And this is a right question. You should know why you have picked up the branch, is something that doctor has just mentioned. So let's end this on a high note. Any motivational words from your end that has motivated you always in your journey and is still doing that? Something that will motivate, the students also and make a mark in their life also.
So with the advent of modern medication, psychiatry is a very satisfying branch. We have more and more people who, even if they are not absolutely fit and fine, at least they are stable.
Yes.
So the goal is now from intervention, it has moved on to quality of life.
Yes.
So if you are able to catch them early, if you are able to rehabilitate them, then you are likely to get people who are going to stick with you, and it's very rewarding. It is very heartening, and I always am very humble towards my patients that yes, you have given me excellent rewards.
That's
a very satisfying kind of work.
Yes. So I'm sure that is the only reason that keeps you motivated every day, satisfying your patients and making them happy. Yes. So I hope everyone have, understood the crux in psychiatry, the thing that keeps Dr. Rahul motivated every day to work the best for his patients, and to understand what exactly the branch psychiatry is, and what and clearing many myths around psychiatry is what he did. And I'm sure this has helped many students out there, because I was getting questions around the same. So please share this also with your friends and colleagues who are in that confusion also and want to pick up the branch but are still confused. I'm sure this discussion will help them as well. Thank you so much, Dr. Rahul, for helping us. And
thank you, Ayushi.
Yes, definitely. Thank you so much for this. And
thank you for giving me the opportunity.
We are actually glad to have you here, more than you think it is. It's really helpful. So now please follow us on our YouTube and Insta pages as well. You may find all the other videos, all our old videos there, which can help you as in some of your career planning and guide you on the right track, because there are many experienced professionals there as well, guiding you and telling you about their journey, as Dr. Rahul just did. Thank you for this deep, insightful discussion. And thank you everyone for hearing us and staying patient with us, because today it has been a bit interrupted session. I'm sure we will get better, and this is something which goes with everybody, and network is something which actually takes a toll at times. Thank you so much everyone for being patient, for staying with us, for being such a nice listener. Thank you so much, Dr. Rahul, for being here. Have a great day today. Enjoy your Sunday. Thank you, everyone. Bye-bye.
Thank you. Bye-bye. Bye-bye.